Hi all. In this video we can discuss about hereditary spherocytosis, which is a type of hemolytic anemias. So this question can be asked as a part of your long essay, short essay, or even as your MCQ questions. So we'll just see more about this topic. So first I would like to start off with the classification of hemolytic anemia. So hemolytic anemias can be due to an intracorpuscular defect, that means which is a problem within the RBC, or due to an extracorpuscular defect. So we'll see each one by one. Which are the different intracorpuscular defects? So it can be membrane defects in which the RBC membrane is affected, or it can be a problem of the hemoglobin. So hemoglobin defects, or even enzyme defects. So because of these three causes, you can have lysis of the RBC. Okay, so what are the examples of membrane defects? Membrane defects can be due to hereditary spherocytosis or hereditary elliptocytosis. Hemoglobin defects include hemoglobinopathies and thalassemia. Hemoglobinopathies are, we'll see what the hemoglobinopathies are. The enzyme defects can be due to deficiency of pyruvate kinase or due to deficiency of G6PD. So coming back to what hemoglobinopathies are, it includes sickle cell anemia and abnormal hemoglobin, and thalassemia can include thalassemia major and thalassemia minor. So these are the different classification of intracorpuscular defect, wherein today we'll be discussing about hereditary spherocytosis. So what about the extracorpuscular defects? Extracorpuscular defects means something is attacking the RBC from outside. So this can be acquired. There could be other causes for that, and even hereditary causes. Acquired causes means there could be some immune mechanisms which are producing autoantibodies against the RBC, or there can be non-immune mechanisms. These are the acquired causes. Others include drug-induced infections or even burns. So that would conclude the classification of hemolytic anemias. Let's discuss about hereditary spherocytosis. So what is meant by hereditary spherocytosis? Hereditary spherocytosis is basically due to a deficiency of spectrin or ankyrin. What is spectrin and ankyrin? See, suppose this is a structure showing the RBC membrane. Here, as you can see, there are some proteins called spectrin and ankyrin, which is basically anchoring the membrane skeleton. So if there is a deficiency with these proteins such as spectrin and ankyrin, what will happen? The cell will be more spherocytic. It will be more spherical instead of the usual biconcave disc shape. So because of this, there will be a decreased surface area to volume ratio, and thus the cell will become more rigid. It is not as pliable and flexible as a biconcave disc shape. So thus, during circulation, the cells are destroyed, especially while passing through the splenic pulp, and you will have hemolysis. So this disease is inherited as an autosomal dominant disease. So basically, you've got a deficiency of protein spectrin and ankyrin, due to which the flexibility of the RBCs are lost and they tend to get hemolyzed. So this in turn will cause anemia, and it is inherited as an autosomal dominant disorder. So what are the clinical features of hereditary spherocytosis? First and foremost, it's basically an anemia, so you will have pallor. Then you can have jaundice also because it's a hemolytic anemia, which means there's an increased destruction of RBC, which is going to cause that yellowish discoloration. You can have splenomegaly again because of increased destruction of RBC, and you can have gallstones in hemolytic anemia. So now, why are there gallstones, especially pigment gallstones in hemolytic anemia? So the cause of gallstones is, as we said before, in hemolytic anemia, there is increased RBC breakdown, which means there will be increased unconjugated bilirubin released from the RBC. So the conjugation of bilirubin in the liver is limited. The liver cannot conjugate all the bilirubin that is coming to it if the unconjugated bilirubin is excess. So there will be increased amounts of unconjugated bilirubin which is released into the bile, which in turn will produce gallstones, especially pigment gallstones. Okay, so this is a physiological basis question that can be asked. Now, moving on, what is a blood picture in hereditary spherocytosis? See, when you're going to investigate a case of hereditary spherocytosis, obviously we'll check for the hemoglobin and RBC indices, but then we're going to check for the peripheral smear. So in the peripheral smear, you can see there will be anemia with spherocytes. The characteristic feature of spherocytes will be that it will not have that central pallor. Okay, so you'll have anemia with spherocytosis, and then you can have reticulocytosis. Why? Because there is increased destruction of RBC, so the body will try to produce more RBCs, and thus more number of immature cells will be released into the circulation, which will cause reticulocytosis. And the other RBCs will usually be of normal size and color, which means there will be normocytic and normochromic anemia. Now, when you check for osmotic fragility, you will find that there will be increased osmotic fragility, and because of increased destruction of RBC, you can have increased bilirubin. Thus, you can have hyperbilirubinemia, increased bilirubin in the blood. So, this is the blood picture in hereditary spherocytosis. So why is there an increased osmotic fragility in hereditary spherocytosis? So for that, first we'll just see the experiment of osmotic fragility. In this, basically we take 10 Kahn tubes. This is how we do it in a practical lab. In the actual laboratory we use another technique, but in a physiology practical lab we take 10 Kahn tubes, and then we add a sodium chloride solution of different concentration, and we add a drop of blood onto each tube. So normally the hemolysis will begin at 0.5 and will be completed at around 0.3. So in hereditary spherocytosis, you can see that there will be an increased osmotic fragility. That means the RBCs will rupture or get hemolyzed much faster. Why? Because there is an absence of spectrin, which means there will be less flexibility, so more fragile, and thus tends to be destroyed sooner. Okay, so here the basic problem is that the membrane is not developed properly. There is absence of spectrin, thus there is less flexibility and hence more fragile. Okay. So how do we manage a case of hereditary spherocytosis? If the disease is mild, you can just give symptomatic treatment, prescribe some folic acid supplements. But if it is moderate or severe, you will have to do a splenectomy. So this is usually indicated for moderate to severe hemolysis with complications. Like suppose you've got severe anemia, gallstones, and it is usually delayed until after 6 years due to the risk of sepsis risk, because we know that the splenectomy can cause the individual to be more vulnerable to infections. But how will splenectomy help in hemolytic anemia? So the reason is, we know that spleen is a site of RBC destruction. So the spherocytes, because their shape is spherical, they are more rigid, and thus they tend to be destroyed faster as it passes through the spleen. So thus, when you are cutting off the spleen, you can somewhat hope to increase the lifespan of the RBC. That is why in hereditary spherocytosis we do a splenectomy. So thus in this video, along with the classification of hemolytic anemias, we've also seen about hereditary spherocytosis. We discussed what the hereditary spherocytosis is, what is the pathophysiology, clinical features, the blood picture, the management, and finally some physiological basis questions from hereditary spherocytosis. So I hope this video is useful for you. Thank you.